A couple years ago, I was wrestling with my cousin. I landed on my shoulder and I was like 18. I'm like, no big deal. It won't be a problem later in life, you know. I'm young.
Your body up just a little bit, good.
Ever since then, it's been popping and ripping out of socket.
When Matt Peary's shoulder injury started getting in the way of his job,
What we need to do, we need to access your shoulder.
his doctor sent him to CDI for an arthrogram.
One of the reasons we do the arthrograms is because when we inject fluid into a joint before we do an MR, we get a lot of additional information about the joint, especially the lining of the joint, the structures that hold the joint and support it, like the labrum and the shoulder and the hip. Those are things that we wouldn't see as well if we didn't have fluid in the joint ahead of time.
It burns a little bit.
The procedure involves using needles to inject fluid into the joint, usually a hip, shoulder, wrist, elbow, or knee.
The main concern is people don't like to have needle procedures, so we reassure them that, one, it's very fast, two, we use local anesthesia, and three, that it is actually a very thin needle that doesn't hurt as much as they would think.
If you feel any pressure or pain, just let them know.
We really can relax the patient. It's all in the technique and how you talk to them, and you take your time with them, and you get most of those patients through.
After the fluid is injected, the MRI scan captures images of the joint, which helps your doctor plan your treatment.
Just trying to get this done as soon as possible, instead of just pushing it off and making it worse.
For Matt, that may mean surgery, but it will hopefully bring relief.